I'm Dr. Green with Seaview Orthopaedics. I'm an orthopedic surgeon that specializes in disorders of the foot and ankle. The Achilles tendon is actually the largest and strongest tendon in the body. It connects the heel bone up to the upper leg. It is used for forward propulsion and tends to be injured in patients who overuse their lower extremities. There are multiple types of Achilles tendonitis. Most commonly affected are runners who have a very, very high incidence of this. There are essentially two areas of the Achilles tendon. The first area is the insertional area of the Achilles tendon, where the tendon actually inserts onto the calcaneus or the heel bone. And then there's the non-insertional area of the Achilles tendon, kind of that rubber band-like looking structure when you're looking at someone from behind. And those are the two areas that can have problems or have pathology. The reason why Achilles tendonitis is so prevalent is the Achilles tendon right at that region has a very, very poor blood supply and is very, very susceptible to injury and very much unable to heal or repair itself. Symptoms of Achilles tendonitis tend to be pain. Patients that have Achilles tendonitis tend to complain of pain with running and jumping activities or any prolonged activities. Patients with insertional Achilles tendonitis will tend to complain of pain with shoe wear or any shoe that has a stiff back, because that will rub up against the tendon and create pain as well. Like all tendinitises or tendinopathies, they are caused by overuse injuries. So Achilles tendonitis tends to be caused by overuse. Some Achilles tendon disorders are actually caused by Achilles tightness, and those are the insertional disorders. The tendon is so tight that it pulls so much on the heel bone that it can actually cause a spur to form, and that bone spur will be painful. Some people are genetically predisposed to having Achilles tendonitis by having a very, very square back calcaneus or heel bone. That's called Haglund's deformity. That can also cause rubbing and irritation and tearing of the tendon. So initial treatment for Achilles tendonitis is traditional inflammatory treatment, which is RICE, rest, ice, compression, elevation. Additionally, you can use anti-inflammatories, either an oral anti-inflammatory or a topical. If that fails to alleviate symptoms in a couple of days, a more aggressive treatment is recommended. More aggressive treatment would include continuation of the rest, but also bracing to allow the Achilles tendon to rest, use of appropriate shoe wear that won't irritate the tendon, physical therapy to stretch the tendon. There are several specific therapy protocols specifically designed for Achilles tendonitis called eccentric stretch, which is a very, very specific way of loading the tendon, and your therapist will take you through that program. If that fails to alleviate symptomatology or your symptoms, the next step is a further workup with an MRI or higher level imaging. Some Achilles tendonitis that is left untreated can cause further problems. As the Achilles tendon becomes progressively more inflamed, the tissue of the tendon will start to degrade. The more degradation or the more tearing of that tissue can lead to such a profound deficit or weakness to the tendon that the tendon can actually rupture. From a preventative standpoint, again, it's watching your activity level. You don't want to be too active where you're doing such a period of overuse where the tendon becomes compromised. And again, a good healthy stretching program to make sure all your muscles are limber is preventative. If you think you have Achilles tendonitis, you should see your doctor, especially if you're having trouble with shoe wear and other types of issues with shoe wear accommodation at the level of the heel, because that can imply some significant damage to the insertional area of the Achilles tendon and does need treatment.